Welcome to today's webinar titled Self-Care, Empowering Employee Health and Wellness with special guest Gary Surmay of Pfizer. My name is Elizabeth Sullivan and I am part of WIPP's Government Relations team. Women Impacting Public Policy is a nonprofit membership organization working to increase the economic power and public policy clout of women entrepreneurs by providing essential business skills education, leadership opportunities for business and personal growth, and a seat at the table among policymakers in Washington, D.C. WIPP was founded in 2001 and is recognized as a national nonpartisan voice for women business owners, advocating on behalf of its coalition of 79 business organizations. WIPP identifies important trends and opportunities and provides a collaborative model for the public and private sectors to advance the economic empowerment of women. And now it is my pleasure to turn it over to our speaker, Gary Surmay.
Hello, thank you. As mentioned, my name is Gary Surmay. I'm Director of North American Public Affairs for Pfizer Consumer Health Care. Today I'd like to speak about how self-care is empowering employee health and wellness. While you may already be familiar with Pfizer, before we begin, I'd like to share a little background about its consumer healthcare business. Like our colleagues in the pharmaceutical business, at Consumer Healthcare, we have a passion to improve people's lives. Our contributions help people throughout the world to improve and restore their health and wellness. The consumer business is located in 90 countries, with our largest presence in the United States. Globally, more than 2,500 people develop, market, and support over-the-counter medicines and dietary supplements. I'd like to begin by speaking with you about self-care. A good definition of self-care was developed by the United Kingdom's Department of Health: the actions that people take for themselves, their children, and their families to stay fit and maintain good physical and mental health. Self-care is not a new concept. In fact, the non-prescription medicine industry is built upon the concept of self-care, being able to understand a condition, reading a product label, and selecting an appropriate medicine to treat a condition. So, as an employer, why should you be interested in self-care? Quite simply, it can help save your business money. The Center for Disease Control and Prevention reviewed over 56 published studies on worksite health programs and found that a well-implemented program can reduce events or occurrences that impact productivity. In a few moments, I'll share some of the most common events and occurrences that impact productivity. A worksite health program is not limited or intended solely for large companies. According to one study, 93% of small business owners, those with between 15 and 99 employees, believe health and wellness programs are good for both employees and their business. Health and wellness programs do not have to contain big-ticket items like gym membership or specific food offerings, but rather can include simple measures like offering fruit in meetings, providing health education, increasing awareness about flu vaccines, and encouraging workplace exercise like using the stairs, noontime walks, or stretching breaks. Interestingly, 88% of Americans would rather be healthy than rich, but only 37% of people believe that they will be in good or excellent health in 10 years. Both patient and physician believe they have a responsibility for preventing poor health, and the majority of people believe that they have access to tools and information to manage their own health effectively. However, almost half of healthcare practitioners, those doctors, nurses, and pharmacists, believe patients understand how to manage their own health effectively. Why should employers care? If people make poor decisions while seeking to improve or restore their health and wellness, there will inevitably be an impact on productivity and possibly health care costs. Let's begin to explore the impact on productivity. This iceberg represents the full cost of poor employee health. For the most part, employers are mindful of their visible healthcare costs, those associated with medical care and prescribed medicines and technologies. But the largest cost to employers are the costs not prominently itemized on an invoice. These are the common events and occurrences that impact productivity that we discussed on slide 6. disability, absenteeism, turnover, and presenteeism. In totality, these underanalyzed events and occurrences represent 70% of the full cost of poor health. The top behaviors that impact productivity include lack of sleep, physical inactivity, and poor standard of care. These 8 risks and behaviors often lead to or result in acute or chronic conditions that require medical care. Under the Affordable Care Act, most Americans have access to health insurance so that they can consult with healthcare practitioners. Unfortunately, the cost of insurance is increasing. From 2010 to 2014, the number of people enrolled in consumer-driven health plans have increased from 15 to 27%, while the average family premium has continued to account for a greater percentage of monthly income. This is especially of concern for families earning between $25,000 and $50,000 a year. In totality, while people have increased access to insurance, they are often not able to afford insurance. Consequently, many people are using less medical care. While this may appear like a reduction in healthcare costs, there is an increase in productivity costs. Annually, U.S. employers lose 485 million workdays, resulting in $165 billion in productivity costs because their employees have a medical condition whose symptoms are not being treated. While over-the-counter medicines do not cure chronic conditions listed, they often provide symptomatic relief. If an employee has an ailment that is impacting their health, based upon national data, the average wait to see a physician is 18 and a half days, with the wait for consultation lasting 22 minutes. During this period, the employee may still report to work or not with an ailment that is impacting their performance. Rather than waiting for a medical consultation, employees often purchase over-the-counter medicines because they are safe, effective, affordable, and readily available. When an employee decides to purchase an over-the-counter medicine, they either go online or to a retail store. They enter the building, they look for the over-the-counter medicine aisle, they seek a familiar brand, and make a selection based upon the symptoms. Unfortunately, the medical names of the active ingredients often do not translate into symptoms they treat. Not many people are familiar with the medical names such as dextromethorphan, diphenhydramine, acetaminophen, naproxen, calcium carbonate, and magnesium hydroxide. But you can help employees by providing them information so that they can make informed purchase decisions. Pfizer Consumer Health Care has provided your membership organization with a non-branded therapeutic guidance to help make informed decisions on respiratory, pain, and heartburn medicines. Let's begin with respiratory products. Here is an overview of the common cold. There are 200 types of viruses. The transmission occurs through touching an infected skin or surface and then touching the eyes or the mouth. Inhalation of viruses in the air form a cough or a sneeze, with incubation lasting between 2 and 3 days. Here is an overview of the flu. There are 3 types of flus: seasonal flu, avian flu, and swine flu. Transmission results from an infected individual via coughing, sneezing, or talking, and there's direct contact with the surface or an object that has a virus on it. Here is a comparison of the two with preventative guides. On the left is the common cold, and on the right is the flu. The best way to prevent the common cold and the flu is to wash hands with soap, avoid contact with cold sufferers, and for the flu, annual vaccination and antiviral medicines. So, when an employee has either a cold or flu and decides to purchase an over-the-counter medicine for symptomatic relief, here is the view when they walk down the aisle. And here is how you can help employees make informed purchase decisions. This infographic is the type of therapeutic guidance that Pfizer Consumer Health Care provide it to your membership organization. If the guidance is posted or distributed, employees will be better able to understand the purpose of the medical ingredient listed. This understanding, in part, will help employees make informed decisions so that they can select the appropriate medicine to receive symptomatic relief so that they can return to work or return to peak performance. Now, let's look at acute pain. Here is an overview of headache and muscular pain. The types of headaches are tension headaches and migraine headaches and sinus headaches. Here is an overview of musculoskeletal pain, muscle ache, sprain, you have a strain, and osteoarthritis. Again, here is an aisle view of pain medicine. And here is an overview of the muscle and joint types of pains. You have, a muscle ache, a sprain, osteoarthritis. Here's an aisle view. And here is another infographic on pain that can be posted or distributed to help make informed decisions. What's an oral analgesic? What's a medicated topical cream? What's a topical heat wrap? And what's a topical cold wrap? Finally, let's look at heartburn. Here's an overview of heartburn. The foods that may contribute to heartburn, such as greased foods, citrus foods. Risk factors, again, include alcohol, obesity, smoking, stress, and some lifestyle changes that may help reduce acid reflux symptoms, avoiding trigger foods, eat multiple small meals, avoid laying down, and raise the head. And here again is an aisle view of heartburn medicines, along with an infographic on heartburn that again can be posted or distributed to help make informed decisions. The types of heartburn classification categories: an antacid, a histamine blocker plus antacid, and a PPI. Here's an additional infographic that can also be posted or distributed. It provides best practices on the proper use and storage of over-the-counter medicines. Remember, just because a prescription to purchase over-the-counter medicines is not required, it does not mean there are no risks. Read the label and use accordingly. So in conclusion, health and wellness programs are not solely designed for large employers. There are a number of employee health and wellness events and occurrences that could impact productivity. There are 4 actions that employers can take that form the foundation of health and wellness programs. 1, provide access to information like the infographics on therapeutic guidance so that employees will be better able to understand the purpose of a medical ingredient. 2, if employees are interested in public policy, they can contact their federal legislator and ask for the restoration of flexible savings accounts to purchase over-the-counter medicines. 3, conduct surveys to better understand your employees' health and wellness challenges and what types of support they're interested in. And finally, if you provide insurance, consider the inclusion of over-the-counter medicines on your medical benefit formulary. Pfizer Consumer Health Care would like to support the restoration of employee health and wellness so that they can contribute to your organization's operational productivity. We provided to your membership organization personalized product coupon codes that can be used for the purchase of Advil, Robitussin, and Nexium. Thank you for your time and consideration. Please consider distributing or posting the infographics on therapeutic guidance, the best practices, and the product coupons. In addition, please consider if you are interested in partnering with Pfizer Consumer Health Care to conduct employee surveys. Thank you.